Good day, I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. This is the RNA series number 64. RNA is nothing but random questions in neurology and neurosurgery with answers by Dr. K Gireesh. This is to benefit the practitioners of neuroscience and the medical field for a lifelong learning and also for public awareness. What is the classical surgical technique used to remove a cerebral hydatid cyst? Usually caused by it's called the Hydatid disease without rupturing. Now, the classic surgical technique used to remove a cerebral hydatid cyst without rupturing. This is called as the Dowling or Landau technique, also known as RNA inigue hydrodissection technique in some references. The principle of this technique is the aim is to remove the cyst intact because it should not get ruptured, and if it rupture it can lead to a recurrence, anaphylactic reaction and dissemination of the daughter cysts. Now, what are the steps in the Dowling or Landau technique? A large craniotomy is performed. The cortical opening is made carefully over the cyst. The head end may be lowered slightly. Warm saline is gently instilled between the cyst wall and the brain tissue. By hydrostatic dissection and gentle gravity assisted delivery, the cyst is gradually expelled intact. These are the steps in the Dowling or Landau technique. A large craniotomy is performed. The cortical opening is made carefully over the cyst. The head end may be lowered slightly. Warm saline is gently instilled between the cyst and the brain cyst wall and the brain tissue. By hydrostatic dissection and gentle gravity assisted delivery, the cyst is gradually expelled intact. The most important surgical principle here is avoid aspiration of the cyst before removal. Avoid forceful traction. Avoid exposure. Adequate exposure is essential, very important. Corticosteroids and antihelminthics like albendazole may be used preoperatively. If rupture occurs, management includes irrigation with hypertonic saline, removal of the daughter cysts, postoperative albendazole therapy, and monitoring for recurrence and anaphylaxis. Now, Dowling or Landau and Landau were surgeons associated with the development and popularization of the classic neurosurgical method for intact removal of the cerebral hydatid cyst, now called as the Dowling or Landau technique. Dowling was a neurosurgeon, and if you go into the history, this technique evolved from the earlier principles described by RNA inigue. So, it is also called as the RNA inigue technique, Dowling method, Dowling or Landau technique. Now, the Rafael RNA inigue was a distinguished Uruguayan neurosurgeon known for his important contribution to the surgical management of intracranial hydatid cysts, who described these principles. And his work laid the foundation for the modern neurosurgical treatment of hydatid cyst or hydatid disease involving the brain. Because of this, many neurosurgical texts refer to the operation also as RNA inigue technique or RNA inigue Dowling technique. He is remembered as one of the pioneers in tropical and parasitic neurosurgery. That's indeed the classical neurosurgical technique in removing a cerebral hydatid cyst. Thank you very much.